and they're located here in Fullerton. Their mission is to provide quality outpatient mental health and child abuse and substance abuse counseling. They want to empower children and families to achieve their potential, as well as increase the community awareness and the importance of the prevention treatment that they offer. Their vision is to make sure that children and parents achieve their best opportunities by utilizing their internal, external, and their interpersonal resources. The population that they serve is it's a comprehensive diagnostic treatment services to children and families and their relationships for basically impaired emotional and behavior problems. So they focus on children that have behavioral problems, or a lot of them that have medical issues and that sort of thing. They have Medi-Cal families. The population they serve is from 2 to 21 years of age. Children with mental health impairments that have been diagnosed by the DSM. And the majority, it's kind of a split, but they have more males than they do females. They have 60 males and 40 females. Predominantly Latino, it's like 80% Latino population, and 15 Caucasian and 5 other. Most common age range is between 8 and 12 years of age. Most of the clients that they serve are from lower socioeconomic status. They have less education, a lot of single parents, multiple employment. A lot of these parents have to have several jobs because they only have one person providing for the child. Many stressors caused by finances. They were founded way back in '67, and they contracted with school districts in the past, but they no longer do that at this time. They currently, well, I guess the neighborhoods have changed, so their situation has kind of changed as well, along with all the changes that they've incurred. They currently have Medi-Cal clients, grants available for children without medical insurance, and they're in the process of working together with other insurance agencies. They have, as far as the services that they have the individual as well as family and group therapy, medication support services, psychiatric monitoring of clients, psychological referrals for parents, bilingual coaches, services in Spanish and English, therapeutic behavior services, and home visits that teach skills and observe implementations for their new skills.
Reducing childhood abuse and neglect. They do so by helping families reduce stress, increase awareness and education on abuse and correct punishment. They're mandated reporters. The prevention and through parent education, classes for appropriate parenting skills, case management and treatment to reverse childhood abuse, teaching discipline methods, and they advocate for the child. Okay. The mental health issues and agency focus. Mental health issues, the agency is dedicated to mental health issues of children. Some of these common disorders are ADHD, or attention deficit hyperactivity disorder, OCD, obsessive compulsive disorder, depression, anxiety, substance abuse, psychiatric disorders, which are very rare, family and mental health issues. The agency focus helps children and families achieve healthier, better balanced lives. They do so through innovative counseling, education enrichment approaches, and medication support. Strengths and weaknesses and needs of the client. The strengths include creativity, willingness, and being helpful to others in the program. The weaknesses include overwhelmed parents, consistency, and parenting views on counseling itself. Methods to anticipate the needs of the client is intuition, collaboration, client goals, the Ohio scale, which measures outcomes, the PCIT, parent-child interaction therapy, child behavior checklists, and PCIs. Collaboration and funding. The Child Guidance Center collaborates with several agencies in an effort to provide thorough service to a diverse group of individuals. Funding, the primary funding is Medi-Cal, but they're in the process of getting approved with other insurance companies. They get money through fundraisers, private funding, and grants.
Referrals to and from the agency. Referrals to clients from CGC include a program called Wraparound, Project Together, Pretend City, which is a kids museum for ages 2 to 7. While the kids participate in the activities at the museum, their parents can attend classes on nutrition and parenting skills. And client referrals to CGC include Medi-Cal, schools, physicians, family and friends, and family resource centers. Staff location and qualifications. There are 3 main offices and 1 branch, and the staff includes 7 LCSWs, 8 LMFTs, 16 MFTs, 3 MSWs, 8 PhDs, 5 psychiatrists, 1 psychologist, 1 psychological assistant, and many interns. And the positions and qualifications, the clinicians have to have an MFT, a PsyD, or an MSW, and the psychiatrists must have an MD. Staff training, it includes weekly supervision for unlicensed staff, monthly meetings and periodic training, PCIT, parent-child interaction training, TFCBT, training-focused cognitive behavioral therapy, PPP parenting program, and parent-child fitness and nutrition training. The staff training turnover rate. Staff turnover, it's the staff sometimes stays short term, and so there's a high turnover rate. This varies from season to season and the economy. One of their goals is to create a longer term stay, and they're doing this by granting the opportunity of licensed therapists to supervise. And intense Medi-Cal paperwork, that's one of the common reasons for the staff turnover. And confidentiality, they keep files locked, they train staff and parents on child cases and confidentiality, provide family group meetings to establish education, awareness of safety measures and support, and they follow the guidelines of HIPAA for the confidentiality. They also do a lot of confidentiality training. All the computers are password protective, and all the paperwork is locked.
Okay, societal programs and program success. The program success contributes to values of children, parental assistance to benefit children. Children are not easily cut from the funding compared to other populations, so they do highly value the children as their participants for the program. Hinder the program success, social stigma about mental health from community and parents. And the impacts of news and media, is it helpful or harmful? Well, in this case, it's both. The news media sensationalize things, school shootings and mental health of children equals fear, and it can increase the awareness and bring conversation to the home in regards to children. The accomplishments and personal rewards. The job aligns with their own personal values and the love of the families. Interacting with the families, seeing kids meet their accomplishments, observing families' behavior in new healthy ways. An example that she shared with us was that an 8-year-old girl was repeatedly raped by her uncle. The entire family came into the Children's Guidance Center for assistance, but the uncle did not. And the girl cried all the time and never responded when she was spoken to. And then after her many months at CGC, she was the head of her class in school. She was communicating with their family again, and she was even in ballet. So that was one of the success stories that she shared with us. And for the greatest accomplishments, just basically watching the family strive and leave CGC with better equipped. CGC trained clinicians, they're qualified professionals. And the length of treatment, there's no really specific time length that the participants can stay there and get treatment. Clients, they can usually stay as long as they like to, as long as they have a DSM, so diagnosis. If DSM diagnosis is no longer there, then the client will be terminated. So if they do not have mental illness or anything like that, then they have to be terminated from the program. The average length of time could be 2 months. That's a high dropout rate at 2 months. 18 months is most commonly for the participants to stay there for 18 months. And sometimes for 6 to 7 years, participants stay there. and the children can self-terminate the program at age 18. And tips towards avoiding burnout would be good support by other staff members. Client contact is good compared to all administration work. Make use of their supervisor. Personal therapy, of course. Have a close friend in the field to refresh each other's perspectives. And do things that are interesting, projects, creative release, and something new. That's it.